Thank you very much for participating in, I think, what could be a very important study with all our members of Parliament trying to deal with some of these issues, and I hope we will see you again as more evidence comes forward. Certainly, the issue of suicide is very complicated, but in some ways it's also very simple, in that the agencies, the adults, the institutions whose job it is to protect children are failing them. And that's what we need to look at. I bring forward the case of 14-year-old Azrea Kopanens, who died in a horrific death in Lake of the Woods. She was involved with child welfare. She was involved with police. She was brought to a hospital, walked out of that hospital in the middle of the night, and the body was found 2 days later. The family is asking for an inquest, and I don't want to deal with the individual case, but what was raised in that story, that tragedy, was that she tried to get mental health services, and mental health services were not available. In fact, in Queen's Park today, in calling for the inquest, MPP Sarah Campbell said, to be clear, these services don't exist. So, do you keep records, statistics, of the amount of requests for mental health services for youth at risk? Do you keep records of how many are denied? And do you have records of what the delay rate for treatment is?
Thank you very much for the question. Yes, indeed, we are very concerned about, the state of mental health services, in Canada in general. This is both on reserve, off reserve for Indigenous peoples and non-Indigenous peoples as well. But specifically in remote and isolated areas, there's a particular challenge. Yes, to answer the question, our department does, have records of, people requesting, for mental health services, and the department does actually provide through contracts, those services by contracting with professionals to actually provide those services, both in person as well as through telehealth arrangement.
Okay, thank you. I only have 7 minutes. That's why I'm being curt here. In our communities that I represent, I hear all the time that people are denied service, or they wait so long the young people go to ground, and we've lost young people. So, would you share those statistics with us so we have a sense of what the delay rates are? Because if we're being told that mental health services simply do not exist in parts of the country, then what else can we expect that these young people are going to fall through the cracks? So would we be able to get those statistics?
Yes, we'll be happy to actually provide those statistics. And it is really important to us that anybody who actually wants and needs mental health services, need to actually get those services, because they're going to get the services to want to get help.
Yeah, okay. Thank you that's excellent. So now you'd said that we've got 10 mental wellness teams in the country. So there's 634 First Nations, and you say they represent between 2 and 10 communities that they service. So that's between about 3% and maximum 20%. AFN said we need 80. Have you costed out what it will take to get us to the full complement of mental health wellness teams?
If we actually, wanted to actually look at the utopia situation, yes, we want to actually, go up to...
It's not utopian.
Yes.
This is about making sure that every community has a mental health wellness team so kids aren't killing themselves. So you say you've got 10, they say there's 80. So have you costed out what it would take to get us there?
Right now, we're actually doing the calculation on how much that would cost. Yes, and we very much like to expand those mental wellness, team services. Indeed.
That'd be great.
And those mental wellness team services, not just providing the services when there's no crisis, but also to try to prevent the crisis from occurring. And then when crisis happens, is to help the community with dealing with the crisis and mobilize other crises, other teams into the community to assist as well.
So we're 70 short. So if we can get the numbers on what it'll take to get us there, because I noticed on the mental wellness continuum that only $350,000 was allocated. We did ask Health Canada about this time, or last time they were there. How much would you need to get the full implementation of the mental wellness continuum framework?
The implementation of the First Nations mental wellness continuum framework is much more than the 350,000, because everything that was done up to the point when the mental wellness continuum framework was developed, was compatible, with, the
But within the
Cultures
framework, there's
Foundation.
only
Yes,
350,000.
but the 350 was purely the very first tiny step to do the pilot studies, and in order to actually, have.
So what will it take to fully implement?
It would actually have to actually increase that to 2 to 3 times the amount that is currently in the budget. So currently we have $300 million a year.
Okay, so I want to go back to the story of the young woman from Lake of the Woods, because the other element was child welfare. Now, Canada has been found guilty of systemic discrimination in the Jordan's Principle case, and in paragraph 458 of the Human Rights Tribunal cited that the 65 agreement in Ontario is discriminatory, and ordered in paragraph 474 that INAC cease its discriminatory practices. And yet, I haven't heard that there's been any change to the 65 agreement to bring the government in compliance with the Human Rights Tribunal. Will that be happening this year?
Just 1 minute remaining, please.
Thank you.
Sorry. Yes, absolutely. The 65 agreement does need to be changed. It does need to be changed in partnership. We can't change it unilaterally. So what the first step was an initial investment, an increased investment in Ontario for child welfare, but recognizing that the 65 agreement is the framework in which child welfare is delivered, so that needs to be reformed in partnership. So we've just started those discussions, and we'll definitely need to continue those discussions over this year to come to a.
And will that include mental health?
It will depend on what are the needs that come out of those discussions, and then we'll bring in our partners as necessary, whether that's Health Canada or others, to look at that.
Thank you very much.